But what we're going to discuss right now is we're going to discuss the idea of fee raises. Now, back in the day, I remember being at a practice where there wasn't a fee raise for a solid 10 years. That's a problem. When we look at the fact that our inflation is 1 to 3% every year in the US, and 1 to 2% in North America in general, that's a real problem if we don't see those yearly fee increases, just because of the fact that when we need to do that fee increase, it's going to be such a big fee increase that our clientele are really going to feel it and potentially turn down services because of that jump. Or worse than turning down services, they would go to other clinics. And unfortunately, when we're talking about fees and when we're talking about people who might be very vocal about those fees, the problem these days is that those people have a big, huge platform out on the World Wide Web in which they can discuss those fees. And so we have to be really cognizant of how our fee increases and how our pricing strategy is going to play out in the internet, where people have tons of access to information. And one of the things that we're starting to see even on the human side is, up until this point, we saw a very behind the scenes type of fee structure. People were being charged things, their insurance was footing the bill, and for the most part, they didn't have a clue as to what those prices even were. We're starting to see more and more that prices are leaking onto the web. So there are websites to actually look at your medical billing pricing and potentially get real-time information as to what your hospital might be charging you, what your doctor might be charging you. There's also ways that people are sharing their medical bills online, and it's starting to be a little bit more very open to the public as to what those medical bills are. And you're starting to see a little bit of an outcry as to really how high those prices are. When we look at things like our spay and neuter prices, well, if we're talking about human medicine, the effective equivalent would be a variohysterectomy, and we're talking about a radical hysterectomy, we're talking about a $14,000 investment in order to do that surgery. Now, more often than not, people are going to have insurance, and so that for the sake of this discussion is really covered. However, when you even look at deductibles, their deductibles are higher than what we're bringing in for normal spay. Now, when we look at what we're actually utilizing, we're utilizing very much the same medical equipment and some of the same trained personnel. When we look at the equivalent of a veterinary technician versus a nurse, our veterinary technicians are attending 2-year programs. We're starting to require licensure for all veterinary technicians. And beyond that, our veterinary technicians have to know so much more than just how to monitor a patient during anesthesia. They need to know how to recover that patient, how to do daily treatments, how to do medication dosing. So when we look at things, we're looking at very equivalent services, and we're starting to see a real transparency in human medicine. Well, we're going to see that transparency in veterinary medicine as well. So we need to think in terms of our pricing strategies reflecting a very transparent type of world. And so one of the things that we want to do is we want to make sure that we're really competitive, and we want to make sure that when we're doing fee raises, that they're broadcast to our clientele to a certain extent in terms of providing accurate estimates, and that secondarily that they're incremental so that our clients don't feel them too difficultly. And one of the things that we've seen in veterinary medicine is we've seen a very slow uptake in terms of our fee schedule increasing. We want to make sure that that's incremental and yearly so that they don't feel a big jump when it comes down to our fee increases. A lot of times too, what we look at is we look at doing fee increases when we're really starting to see some of our income downsize or decline. The problem there is that if we rely only on fee increases and not increases in the number of procedures and the number of patients, we're really going to see a clientele who feels put off by the number of fee increases or by the size of those fee increases and searches elsewhere for our service. And so we want to really think in terms of how can we do these fee increases so that our clients don't feel them too difficultly, and so that we don't lose clients or procedures in the process. We're going to discuss all of that in our classes upcoming. Thank you.